evaluation or return demonstration, we will be using this checklist. Now, this checklist will evaluate you on your 3 skills: cognitive skills, psychomotor, and affective skills. So the cognitive, as mentioned, all the necessary informations that you need are on the module. Okay, so each procedure has certain questions that you will be asked during the evaluation, just to check if you know the procedure and all the things about CVC. Psychomotor, this is how well you are doing the procedure, and affective will be the attitude. Okay? So the next procedure will be about blood sampling and CVC and flushing via CVC. So the same with any other procedures, we have to verify the physician's order in the system. And because this is blood sampling, we need to print sample labels. Okay? After printing, we can gather all the necessary supplies that you will be needing. Make sure that you check the integrity of the supply that you will be taking. All the supplies that needs to be sterile will be kept sterile. The tubes should not be leaking, no discoloration. Okay? Once you have gathered all the necessary supplies, of course, before going inside the patient's room, proper hand hygiene. We will also evaluate you regarding this hand hygiene. Okay? So make sure you will be doing it properly. Then, put on the necessary PPE as indicated for your patient. But for demonstration purposes, we will just be utilizing our gloves. Then, entering the patient's room, introduce yourself. Baba, I am Almarie, your nurse for today. Then, identify your patient, either from the patient himself or the significant others, asking their full name. Then, verify it against their ID band and the sample label that you have printed. Full name and their MRN. Once you have verified the patient's name, you have to explain the procedure. Baba, I will be taking blood sample from your central line as ordered by the doctor. Okay? If the patient agrees, then provide privacy. Okay? Adjust the bed to a comfortable working height. Then expose the ports wherein it is in easy access. Okay, proper lighting. Then, before you will be doing the procedure, the first thing you need to do is assess. Always assess first, especially if you are dealing with central line. What are the things we need to assess? Sight. Note for any signs of complications, signs of infection, redness, warmth, swelling, signs of any abnormal discharges, pus formation, phlebitis, okay, catheter migration. So if you noted any type of this complication, then you just have to immediately inform your doctor. If there are any no signs of complication, next, assess your dressing. Your dressing should be clean and intact. Any signs that the dressing needs to be changed, soiled, loose, damp, or it is due for changing, then we need to change the dressing first aseptically before proceeding with blood sampling. Next, now we have this type of catheter. We have 3 ports. Okay, which of these ports you will take blood from? So the first consideration would be choose the port who has a largest lumen. Okay, so in this catheter we have 3 ports. It is properly labeled. We have distal port, medial, and then proximal port. Now among the 3, the distal port will always be the largest, ranging from gauge 14 to 16. Okay, and the other 2 gauge 18. Okay, so among the 3, if all are free, we will be choosing distal port. Now, if in case the distal port is not available because there's an infusion ongoing, then we will be choosing the proximal port. Why? Because this type of catheter has staggered exit, meaning the distal port, the exit is on the farthest end. Proximal will be the first exit and medial between them. So imagine if you have infusions ongoing on your medial and distal port, you can take blood from the proximal without contaminating it with any infusions ongoing on your medial and distal, because they will be going with the blood flow. Okay, so you will be taking pure blood from your proximal part, which is the first exit. Okay, next, if all have ongoing infusion, of course you have to determine which infusion you can stop or pause for a while. So in that case, make sure that all the infusions that will cause hemodynamic instability to your patient, if you stop them, then put them on your distal and medial ports, so that your proximal will be for the infusions that you can stop for some time. Antibiotics, IV fluid, okay, so that you can stop the infusion and take blood sample from your proximal. Okay, are we clear with which port to use? So if you have determined which port to use, then remove your gloves, perform hand hygiene, don another clean gloves, then you can now prepare a clean work area. So you will be needing syringes, okay? Then you can also open it halfway, so it will be you will have an easy access to your supplies, even if you will be using just your one hand. You will also be using or needing a pre-filled syringe of normal saline. So you have to break the seal. So keeping the syringe tip still inside, so loosen the cap, break the seal by pulling the plunger first, then slowly release the air or remove the air. Then after which, you will also be needing, of course, gauze, alcohol swabs, the tubes, you can arrange them as per the order of draw, extra sterile cap or cover, or if available, better, Curos or disinfecting port. Then, of course, your biohazard bag and your labels. Now, you can take the gauze and then put it under your ports. Now, you can notice I did not open any dressing pack or have a dressing sterile field or use a sterile gloves. But we have still to keep this procedure aseptic as possible. We will just be using what we call aseptic no-touch technique. So we will discuss it along the way. So if your port is having continuous infusion, then of course we have to stop if it's applicable, or if it won't affect your patient's hemodynamic stability. Clamp the catheter, and then so that we can resume the infusion after blood sampling, disconnect the infusion and put a sterile cap or sterile needle. If you notice, I did not touch the tip of the infusion tubing and the tip of the sterile needle. So this is an example of aseptic no-touch technique. So you can resume it after blood sampling. Next, if the port that you will be using is covered with this type of cover, which is the disinfecting port, clamp, remove the port, discard, then you may resume with your aspiration or blood sampling. No need to disinfect because it's already a disinfecting port. If the port is just covered with this type of cover or came from an infusion, then we have to clamp first, remove the cap, discard, then take an alcohol swab, then disinfect the port by scrubbing vigorously, 15 to 20 seconds with friction. Okay? After which, let it air dry for 30 seconds. Then now, take a syringe. Okay? Then, again, aseptic no-touch technique. I won't be touching the one I disinfected, and I won't be touching the tip of the syringe. Connect. Unclamp. Then aspirate 3 to 5 ml of blood. Why are we aspirating first? What is the use?
True.
First, to remove any medication that is in the catheter or flush, so that on the next aspiration or withdrawal, it will be for your sample.
Blood sample.
Another is to check the patency of your catheter. Of course, it will be considered patent if you will be able to withdraw blood smoothly. Okay. Now, what if you cannot? There is resistance, you cannot withdraw blood. So, first, we have to do some simple troubleshooting. We can ask the patient to cough, okay? Because sometimes the tip of the catheter is lodged in the vein wall. So by coughing, it will help to release it. Then try again. If still not, we can also ask the patient to reposition the hand. Put the hand up or other sides. Then try again. If still unsuccessful, that's the time you have to stop the procedure and inform your physician. Because it's a sign that this catheter is not patent. So in case you were able to aspirate blood, remove, discard, again, disinfect, vigorously scrubbing the hub 15 to 20 seconds, and then air dry for 30. Another syringe, aseptic no-touch technique, then take the blood that as per order of the doctor. Minimum amount to conserve the blood of the patient. Then, again, clamp, put it aside for the meantime,
Flush.
and then, again, disinfect. Why are we always disinfecting the port? To prevent a life-threatening complication, which is CLABSIS, central line associated bloodstream infection. That's why each and every time we have to really disinfect the port. Once it's air dry, take your normal saline, pre-filled syringe with normal saline, and flush your catheter. What is the technique?
Push-pause
How do
technique.
we call the technique in flushing?
Push-pause.
Push-pause technique, yes. Push-pause technique or pulsatile technique. Why do we need to do this type of flushing or technique?
It creates
Because in doing so, yes,
turbulence.
we are creating turbulence or little pressure inside the catheter. So all the debris, we will prolong the catheter because it will prevent blockage or blocking of the catheter. So push, pause, 1 ml, push, pause, 1 ml, push, 1 ml. Then, once you have flushed the catheter, clamp, remove the syringe, and then either you resume the infusion, connect, or if this is available, the disinfecting port, then we can just cover. If not available, then a sterile or new sterile cap. Okay? After which, then we can put the blood as per order of draw. Okay? Label. Verify it first again from your patient's ID band. Then label the blood tube in front of the patient at bedside. Then put inside our biohazard bag. After which, position the patient in a comfortable position, discard all the things that you have used, and of course, health education to our patient. What do we need to tell the patient? Inform us immediately if there are any signs of complication that we have mentioned. Do not remove the dressing of your central line. Do not pull do not put anything to your central line. So this health education actually are all enumerated in your checklist. So just familiarize them, and of course documentation. Okay. Now what if the order or here the order of the doctor is just CVC coagulation? So you only just need 1.8 ml. So can I use 3 ml? 5 ml? We needed to conserve blood, right? Can I use 3 ml, 5 ml for CVC? Anyone? Yes?
Better to extract directly to the brain. Charot. Huwag na gamitin yung... Because we are conserving blood, most especially if patient is anemic.
Okay, let's say not blood. I will be giving medication. I just need 2
Okay.
ml.
Yes, ma'am, but it depends.
Depends on what?
You can make it, you want 2 ml, right?
Uh-huh.
2.5.
Oh, yes,
You can
the
use 5 ml.
we will use 5 ml.
Yes, ma'am. It depends
Pwede pong
on
ibalik.
the availability of the syringe.
Yeah, that's right. So all of you agree we can use smaller than 10 ml? Exactly. Syringes smaller than 10 ml causes a lot of pressure to our catheter, risking it for damage, even breakage. Okay? So if we will be accessing or using syringes for our central line, we could only
Always 10.
use minimum 10 ml. But for flushing, if we will be using flash, we can use 3 or 5 because the diameter, they are all the same, even though the amount are less.
Okay.
Okay? So it's clear. Ha? Minimum if blood sampling or medication 3 ml, but for flushing, if flash, any amount, or 3 ml, 5 ml, or 10, we can use for our CVC. Any questions, clarifications regarding blood sampling? None? Thank you very much. We will now proceed with our last one.
Good po.